Hi, everyone. Thank you for joining us. My name is Jim Schultz, and I am the Director of Governmental and Public Affairs for the New Jersey Dental Association. Joining me today is Dr. Elisa Velasquez. She's a pediatric dentist here in New Jersey. She is the NJDA Treasurer and the current President of the New Jersey Academy of Pediatric Dentists. Thank you for joining us today, Dr. Velasquez. Look at our topic.
Sure.
So, you're a pediatric dentist. So I have to ask, what's the difference between a pediatric dentist and a regular or general dentist?
No, that's a great question. And we get that question a lot. So pediatric dentists we all went to dental school. So everyone goes to dental school for 4 years. And then some people decide to specialize in various specialties. So if you want to be a pediatric dentist, then you go to 2 years of additional training in a residency program. So I like to consider us the pediatricians of dentistry. So we're all dentists, but focusing and specializing on pediatrics.
Can't all dentists treat children?
Absolutely. All dentists do receive some training in dental school to work with infants, children, teens, adults, special needs patients. So general dentists do a lot. But pediatric dentists have that extra training to work with only children and special needs patients.
So why so early? At 6 months, most kids barely have any teeth. Shouldn't we wait until they're a little bit older where they have a fuller set of teeth so we can examine and clean them better?
No, so we definitely recommend that you bring in the child when the first tooth erupts. So a lot of that visit will be an educational visit with the parents or caregivers. So one of our goals is to review the different milestones that the child will experience over the next 6 to 12 months, as well as evaluate the risk assessment of that individual child. So for example, we'll ask some questions about the prenatal care and how the pregnancy went. We'll also ask questions about the parents or the direct caregivers' dental health, as also starting to review oral hygiene habits, nursing habits. And then we do a clinical examination of the hard tissues, including the teeth, the palate, the bone structure, as well as the different attachments of the lip and the tongue, to evaluate things for like lip tie and tongue tie. And then we start to create an individual plan for that child, of what to expect during their infant toddler years.
So what should a parent expect when they take their child to the dentist?
So that first visit often is, the examination portion of the visit is pretty quick. So often we do it in a safe position that we call like a knee to knee position, where we lean the infant backwards, and to allow the dentist to examine that child's mouth. And then as the child gets a little bit older, one of the other great benefits of coming early and often is desensitizing the child to future visits where they know this is part of routine and that it's fun. So every child is different. So the visit and the experience does have to be customized to that individual child.
When do you start performing x-rays on kids? I know that some people have raised concerns about exposure. And while we've done a lot in policy to make sure that those are reduced, we certainly understand why parents are concerned, but they're very necessary. Maybe you can explain a little bit about radiographs.
Sure. Yep. So x-rays or radiographs of the teeth are definitely important. So we don't have a cookie cutter approach. So it will depend again on that individual child, the way their teeth are erupting, the pattern of which they're erupting, how close together the teeth are, their risk assessment. If they already have visible decay, we may have to do the x-rays a little bit earlier. Some children need x-rays every 6 to 12 months, where some might not need them for every 12 to 24 months. So it will really depend on that individual. But in order to do a proper examination, at some point, absolutely x-rays are critical.
Well, and I certainly know that as a child, I didn't always have the perfect teeth. I do remember many days going to the dentist and having to get my teeth filled. And I was pretty anxious about that at times, and I know I'm not alone. How do you approach a child when they really do need some work done, where they're getting a filling or they have to have a tooth extracted? And is it common to restrain a child? Because I know that I don't like people touching my mouth all the time. So maybe you could walk through that. I know some parents have questions about, is it necessary to have a restraint?
So unfortunately, some children do require dental treatment, whether it be fillings or more complex dentistry. And assuming that that child had come in for frequent visits, we hope that there's already a relationship with that dentist and the dental team, and a trust with the child and with the parents. Unfortunately, sometimes we don't meet a child until they're 6 and they already have a dental infection, and that can be definitely very scary for a child. So as pediatric dentists, we definitely have additional training in child psychology and different modalities for behavior to help a child go through an experience that, like you said, isn't really that fun. So we know that certain dental procedures are not fun for adults, and certainly not for 4 or 5-year-old. So there are different adjunctive procedures we could do. We could use laughing gas, which is called nitrous oxide. There are different oral sedatives that can be used. And sometimes some dentistry has to be completed under general anesthesia with the supervision of an anesthesiologist. So sometimes those things are necessary. Regarding restraint, none of us are in the business to try to scare kids or traumatize anyone. But unfortunately, sometimes if it's an emergency situation, sometimes a restraint is necessary. If a child broke their leg and they were rushed to the emergency room, they may have to be restrained in order to have that leg taken care of quickly and safely. And unfortunately, sometimes for dental emergencies, we're in that same boat. Any restraint, whether it just be mom holding the kid's hands, or having a dental assistant assist, should be a conversation that the parent has in advance with their child. I always will talk to a parent about expectations and get verbal and often written consent for something like that. And sometimes it's unfortunately the only way to help a child with an infection or extreme toothache or due to some physical trauma of their teeth.
So how can, as a parent, I help my children be less anxious about going to the dentist? I certainly don't want to impose my feelings on that. I think dentistry is in a different place than it was maybe when we were younger, but going to a pediatric dentist and being in a positive environment, but still that anxiousness of going to a doctor is always a little unnerving for anyone at any age. How, as a parent, can we help with that? And is it commonplace for a parent to be in the examination room with you while you're treating or your hygienist is treating?
So the best thing that a parent can do to help a child have decreased anxiety going to the dentist is by bringing them early and frequently. So again, starting at the age 1 first visit and then being seen every 6 months does desensitize a child and acclimates them to the procedures, to the environment, to the people. So there are other things that parents can do because every child is different, and some kids do experience a higher anxiety. They have so many cool books that parents can read to their kid in advance. So if they like Elmo, get the Elmo book. There are really great videos on YouTube. Some kids like seeing things in advance. So there's something called a social story, and social stories are picture books of what to expect before doing something. So there'll be a social story before a dental visit. There are some generic ones through the American Dental Association, American Academy of Pediatric Dentistry. Like, for example, I have one that I made that's on our website. We have some YouTube videos, things like that, that really help kids know what to expect in advance. And that helps put the parent at ease too. So when the parent's comfortable, I think that translates to the child, because you're right, we don't want the parents' individual fear, because who knows what happened. They may have had a bad experience when they were 5, to not be given to their own individual kids.
So let's talk about toothbrushes and toothbrushing for a second. You know, that's a very common question that gets asked. How much toothpaste should we use? Should it be fluoridated or not fluoridated? And how often should I change my toothbrush? And really, even how often should I brush my teeth?
Yep, so definitely we recommend that all kids start brushing their teeth 2 times a day. So it should be 2 times a day, 2 minutes each time. If you could do a 3rd time, even better, but the minimum would be 2 times a day, time for 2 minutes. Toothbrushes, they make a different ones by character or by color. So that will really depend on your individual child. But we recommend that the toothbrushes be changed out probably every 3 to 4 months. Obviously, you would want to examine it. If it's very freed, you may have to do it a little more frequently. So the big question though is toothpaste, whether it be fluoridated or not. So in New Jersey, we're the least fluoridated state besides Hawaii, and we absolutely recommend that children use toothpaste with fluoride. It's all about how much you use. So many of the commercials might show this large ribbon of toothpaste, but it doesn't have to be that big glob, because then of course that could increase the chance of ingestion. So for kids that are having a difficulty spitting, or due to their age, they're unable to spit out properly, a little smear of fluoridated toothpaste is very effective. So imagine the size of a grain of rice. And then as the child gets a little bit older, then we ask that you would increase that size of fluoride toothpaste to more of the size of a pea. And keep working with the child to spit it all out. We don't want them to ingest it, of course. But fluoride toothpaste is the best defense to help kids not get cavities.
What about the infant child, that one who's 6 months to a year, who may not have any teeth? What, as a parent, can we do to help make sure their mouth and pre-erupted teeth are as healthy as they can be?
Yeah, so before any teeth erupt, we do recommend that you would wipe out the child's mouth. They sell all these different gadgets. They have these like finger cots or finger toothbrushes where you could just wipe the gums of that child. And we also want to make sure you're removing any milk residue or whatever they were eating. So that could just be with plain water if there's no tooth present. If the child has, just barely erupting of a tooth, they do have the infant safe to swallow teeth. But once several teeth start erupting, then we do recommend that small smear of fluoridated toothpaste.
Going back to the tongue, should we be brushing our tongue?
Yep. So the tongue definitely harbors a lot of bacteria. So it's a good habit to teach children, while they're brushing their teeth, it should be a minute on the top, a minute on the bottom, and then quickly brush their tongue as well. And then it gets them used to that feeling.
I know we have a tendency to rinse and spit at the dental office, but when should we start to use mouthwash for our kids?
Yep, great question. So regarding mouthwash, that should definitely be after the child is able to completely spit it out. So you don't want them to take the chance of them swallowing it. So every child's different. That could be somewhere between 3 and 5 years old before that needs to be introduced. If someone is on the high risk where they have a whole mouthful of cavities, we would really encourage someone to practice with their child at, say, like age 3. And that should be a conversation that the parent should have with their dentist, because everyone would be different.
So Dr. Velasquez, I would love to come to you. I know that you're a pediatric dentist. How old is too old in your pediatric practice?
So in my offices, we see kids until the college years. And I believe most pediatric dentists see kids up until they finish their college or around that age range, up till age 21. So you're a little too old, Jim.
Just barely. And will you help us transition to the next level, to a general dentist, to help us identify one who's as good as you and as comfortable as I feel?
Yep. So most pediatric dentists have a really great relationship with the general dentists in their communities. And it's a conversation we start having with the kids, even at age 16, and we start asking them what they're comfortable with. And some parents and the kids are like, please, I don't want to leave yet. And then some kids at 18, they feel they're ready to transition to an adult dentist. So sometimes it is an individual choice. And absolutely, we make referrals, and often the parents have someone that they're comfortable with, and usually then the adult child would go there.
Thanks, Dr. Velasquez, for joining us today and really giving us some wonderful information, things I didn't know, and I've been doing this a long time. It's always great to hear from you and to learn more about what we're doing. Remember, everyone, if you ignore your teeth or your children's teeth, they will surely go away. To find Dr. Velasquez or another NJDA member dentist near you, visit www.njda.org and look under the Find a Dentist section. Thank you all for joining us and have a great day. Bye-bye.